What we know is that President Obama has admitted, his people have admitted, that the bill was supposed to bend the cost curve, and it will not. And this was what they admitted to us. So this is the first part. The second thing is, I did want to point out that the public, we're getting a lot of misinformation
What's
here.
a reference?
That's just not true.
What's a reference for that?
If you let me finish, I mean, nobody interrupted you all. The other thing is that there are things in most of our states that are called high-risk pools that have addressed some of the concerns. It's not as if there are no concerns for people that have pre-existing conditions in the past. And I think that was one of the conversations that was left off the table. In other words, there are some things Missouri has. When we were just talking to Mr. Nager, that I was asking him about some of the other high-risk pools. But so that's a fact. But I mean, maybe more importantly, you refer to it that this isn't socialized medicine. You wanted the public option, you know, like others, and there was a conversation that this isn't Obamacare. I guess it's Pelosi-Reed Obamacare, but whatever it is. But the fact is that when you then refer to the decision-making is being made by the government and deciding how our health care is going to be dispensed, what will qualify, what the care will be, that is headed towards government-run health care. So
No,
if
it's not.
you
It's
can
still going to
quibble
be
with
your
the terms-
doctor deciding. Your
Again,
doctor decides.
You can quibble with the terms, but the power that's being given to Kathleen Sebelius and others to decide our health care is problematic to some of us. Perhaps not to you, but to some of us. And that's what I think people mean when they say that we've headed towards a system. And candidly, the proponents of the public option are very comfortable saying Canada, which is described as a socialized medicine, is a public option. And so you may not like that term, but most Americans recognize that's what is happening in our country.
Medicare is a socialism. So Medicare is socialism.
No, I think what you're describing, government-run health care. Again, you asked, you want public option like Canada. That's what you said.
We wanted it, but we didn't get it. We didn't
That
get
is
it.
described as socialized medicine. So that is different than a certain type of program that enrolls a certain number of people.